Okay, hello. Let me know if you can hear me.
We hear you.
Can hear you.
Okay, thank you. Let's see. Got a couple more people to let in here before I'll get started. But you're always welcome to start your questions if you have any at any time. Yeah, I can barely hear you though.
Can you hear me now?
Now it's better.
Okay, I have a request. Can we have more sample quiz on P3?
More what?
Sample quiz?
You don't need a. Frankly, I don't want to waste your time. That won't help you. Okay, what will help you is what I'm going to do today. I'm going to go through all the material.
Okay,
Okay.
thank you.
And then at the end, if you feel you need a sample quiz, well, you weren't listening to the material. So I think we'll take care of it.
Okay.
That's what I want to do mainly today is to go over the material for P3. I've been looking at how many days we have left before freedom arrives, and also your grade. You have a fair amount of time for the next section, the last section. But after the test on Tuesday, you have a holiday. Well, maybe you need it. You have another holiday 2 weeks after that, Thanksgiving. So you're going to have time off in a sense. Is nothing going to get accomplished during that time off? No, not if you study. You know, when this class was first given online, it was done asynchronously. Now, if you've forgotten what that term means, it's easy. Asynchronously means you and I wouldn't see each other. I wouldn't respond immediately to your question. I would have to do it by email every time. In those first days of this class online, all the material was posted in the modules just like it is right now. And I would post it on Monday night because everybody posted on Monday night. You probably have classes that do that. And then on Tuesday morning, it would open up and the class was supposed to read it and study it. And I was never there. I never commented. I never said anything because it was an asynchronous class. They did well. They did well. But I think you can do much better when you get an opportunity to settle any confusion you have by asking a question immediately. Okay. So during the 2 holidays that you have, I'll still post material. I'll still go over it when we come back together. But you're welcome, of course, and even encouraged to go ahead and read it and learn it. Okay. And then treat the conversation we have when I get back or you get back as so much review. And there's a lot of material in that last section. And the tests are all bunched up at the end. You'll have the lecture test on our last regular day. And on the day of the final examination, which is the 16th of December, you'll have the final exam, which is short. It really is short. And you'll also have the fourth practical. Okay. That can sound like a lot to some people, but again, all the students who did that before you, the last few semesters anyway, have had no complaints about it. You know, the complaint was, oh, I didn't understand that question or this one. You know, the typical stuff that we can take care of, but no complaints about the timeline at all. So you might have some concerns, and you may not believe me when I tell you the concerns are baseless. You really don't have any need for them. Okay. Unless you don't study. If you take the holidays, you know, day as a day off, and don't find time to study in the meantime or around it, you may find yourself playing catch up, but you can do it. A couple of words about the exam on Tuesday. 100 questions, multiple choice. And you need good Wi-Fi. Okay. I had one person, oh, it's not an embarrassment. Tristan, you're around. I saw you. You here still? Yeah, there you are.
I'm here.
I see you. You had, while you were taking the test, every one of you, I went and looked at your test log as you were taking it to see if you were going to finish the test, how long it was taking you. For one person, I noticed way too many lookaways, and I immediately wrote that person and said, "Stop it." Okay, lookaways are looking away for often for an answer someplace else, having two monitors going at the same time. I looked at everybody, and I looked at Tristan's, and about a third of the test was done, and he had 10 questions answered. And I was wondering what the heck's going on. So I wrote him. He probably didn't read my email until he got finished. But his internet, he said, acting up, and he got it together, and he did have enough time to finish the test. So there was no lasting problem there. But you can't have that happen to you on this test coming up. It's full of pictures. It's just image intense. We've had this before on the muscle exam, and if you got through the muscle exam easily, you should be able to do it the same with this one. But you can't use and expect to be successful a cell phone. You can't use crappy Wi-Fi. You know, maybe that's all you care to afford. Then go to the library, go over to the school, do it using their Wi-Fi. Okay, it's quite good. You have to think this out ahead of time because on Tuesday it's too late, obviously. If somebody in the house is playing some video game or something like that, or streaming a movie or something, you gotta let them know ahead of time that you're going to be taking a test for 80 minutes, and you really need to have all the Wi-Fi that you can get. Also, your position, of course, in the house. Get closer to the router if you can. Okay, and if you think you're going to have trouble, well, you can let me know. I'm not the IT tech, however. I think I try to give you all the hints that I know, and they always seem to work. If for some reason the pictures do not load for you personally, or a set of them don't load, okay? And all the rest do. Well, we've got a problem, okay? If they don't load and you're seeing it immediately, you can email me right away. I'll check the email during the test, and I will end your test and start you on a new test. And usually that second test comes up and it's perfect. Otherwise, we can refresh, and that may do it as well. If you get sort of sleepy eye images, that is, they sort of scroll down from the top of the page. Okay, by the time they get to the bottom, which may take a minute, all of the pictures have done the same thing, and you're fine. At first, you may have all these 100 sleepy eye pictures, but if they're coming on, they'll all come on, okay? If you've already seen that happen, it's probably going to happen to you again. So be prepared for it and see if you can, somehow get a little bit better internet, okay? Any questions about that? No? Good. Now, in order to get your Zoom credit for the practicum, and it's only given on the practicums, so you get it here and get it one more time on practicum 4. You have to have the chapters in. Well, there's only 3 chapters. If you don't remember the chapters, you can look them up on several ways. I'm going to give them to you, of course. You can look them up on Charlie's website. I hate to use my own name, but it tells you where you should be going. And under reading assignments, it's been updated as your current reading assignments all in a row. Okay. You can also go to the modules and hunt tech and go through every assignment and see where we are. Or you can listen right now and write it down. You need chapter 19, 12, and 15. And I do not I will not take them after the test is started. Sometimes I really cringe when they come in just before the test because I realize the person has put off studying this material, outlining material, and now is crunching it in at the end, and instead of studying for the test itself. Not good time management, I guess, but for some people, it works. Okay, now, any other questions? Okay, I was thinking over the P3 examination, okay, and we used to call it the circulatory system exam until it spread out to much more material. In the in-face class, on-campus class, I set up that test so many times. It took 7 hours to set up the test. It was a long one, not a long test, a long setup. And I got to the point where I had it memorized. At first, it took 7 hours, and when I was finished years later setting it up, I could do it in 3, but never any less than that. Other people would volunteer to help, and I said, "Get away! You just slow me down." I knew where everything was, and so based upon that, here's the way the test was set up in the classroom. It should give you an idea of how many questions are coming at you from each section. Your test will not be set up in this order, okay? But I think you'll find it interesting. The first 4 questions were on the brain. You can write this down. You can come back later on and get it off the recording. You don't have, or you can just listen now. The first 4 stations, I should say, were on the brain. That's 16 questions. The station was 4 questions. 3 of them were brains. and 2 of those were sheep brains and 1 was a plastic brain. The 4th station was functions of the brain. The 5th station and the 6th station and the 7th station and the 8th station, that's 4 stations, that's 16 questions, were on the heart. I used sheep heart, I used plastic heart, and I used a station with a combination of both. The next station, which would be station 8, was a sit down, think it out question. Okay, in other words, there was no setup there. You just had to know the material that we talked about during the practicum preparation. So there's really not much I can say about that one. The 9th station was the vertebrae, the cervical vertebrae, and it had 4 questions to name the parts. The 10th station was a sit-down question. In the sit-down question again, there's no setup, there's just a question. These questions primarily were for fetal circulation. I recall now also that there were a couple of fetal circulation questions over in the heart area that I passed a little while back. Then there were 2 more stations, numbers 11 and 12, for a total of 8 questions on the ear. Those questions involved identifying parts of the ear, or give me the function of the part of the ear, such as the function of the eustachian tube, or the function of the semicircular canals. Those are pretty good ones and pretty standard at that. Station 13 was a sheep eye, a dissected eye, real one. Name the parts. And then number 14, station 14, 4 points to identify portions of the plastic eyeball model. 15 was a microscope station. Hell of a thing to set up. You think you got it done, and somebody closes the door, shakes the room, and it's all a mess. But we don't have to worry about that. But what was included there was white blood cells. Name this white blood cell. What does this white blood cell do? Okay. So it gleans a tiny bit of overlap, tiny bit, maybe with lecture material. Just there. Also, you need to know the difference between an artery and a vein. And I'd like to show you that today again on the website. Okay. And then we move to station 16. Station 16 through the rest of the test would be 40 questions. There were 25 stations on the test. There were 40 last questions, 4 per station. And at each station was a cat. In those days, it changed since, but you would be asked to name 4 pinned vessels. Don't have to give right or left, artery or vein, just the root word, such as subclavian or brachiocephalic. Okay.
Right.
Yes.
What did you said? Name what with the cat vessels?
Well, I was just throwing out examples.
Right. I
mean,
didn't catch it.
I'm not saying that those will be on the test, although I can't imagine a test without asking brachiocephalic. You know, that's too much. But not all of the vessels will be on the test.
Okay.
But there are a total of 40. Now, only 28 of those were actually on the cat, of those 40. The rest were on the Flatman model. Okay. And also, there was a stand-up heart with the vessels coming out of the aorta. Remember the ABCs? The ABCs? Quickly review it then if you need to. Okay. And remember the model on the skull, where I showed the common carotid, external carotid, and internal carotid, and the vertebral. Okay. That was a skull model. I'll probably see it today with you. Okay. I want to go through all of the vessels with you, and when I do, that'll be there. Okay. The torso model was the last station on the test. It was station 25. That torso model, well, there's lots of torso models, but the one I used was to show that in humans, we have a common iliac artery. In cats, we do not. In humans, we have a common iliac vein, and in cats, we have a common iliac vein. The difference here, and you got to be able to see that most of these vessels run similarly in cats and humans, but humans have a common iliac artery, and cats do not. So once you identify the common iliac, you don't even have to say artery now. Just common iliac, internal iliac, external iliac, then you might be asked the mid-sacral on that one as well. Okay. Any other questions while I'm thinking through what I wanted to tell you? I think that's what I wanted to tell you. I think I'm done.
Next semester, will you do both online and in person or just one?
I'm just going to do in person.
Got it.
Okay. Most of the grades in the class, I think, are acceptable to you. I think you're getting the grade you want right now. Maybe I'm wrong, but you know where you stand. I showed you the scores Tuesday. If you did not receive the grid with your score on it, perhaps you're not even getting my emails. And if you're not getting my emails, if you haven't gotten at least 2 a week, please write me and let me check and see that we have the correct address for you. When you check your scores, be sure always, it's easy to make this mistake. The mistake being looking down the wrong column. Okay, if you look down the wrong column, yeah, it's not going to make any sense. Okay, look down the correct column and you'll be fine. Okay. And okay. Okay, yes. I know you have a holiday coming next Thursday, a week from today. Okay. But I think some people having all of their finals, if they're taking more than one class, lumped together, are going to feel it's, push come to shove. I did when I was in college. All the finals came together. Midterms and stuff, they were always scattered. And usually you could cut a break there. But on finals, they all come at the same time. So some of you may not want to just sit and wonder what you could be studying And so what I'm going to do at 4 o'clock on Tuesday, just like we did last week, after the practicum, okay, I'm not going to discuss the practicum. I will with you by email, of course, but at 4 o'clock, and I'll remind you of this, I'm going to open up in the discussion section. If you're not enrolled in that, then you look at the recording. Okay. I'm going to open up in the discussion section and give you guidance, if I can, for what you can be studying for the next couple of days while we're gone. Attendance isn't mandatory, and no bonus credit, no Zoom credit is going to be given for that. So it's, you want it, you come. If you don't want it, you don't. Or you watch it on video, okay? I'll remind you of it. It has nothing to do with the P3 whatsoever. But I really want to get you started on the histology more than I have, so that that doesn't pile up towards the end. Okay. I like this test. I mean, I don't have to take it, of course. I like this practical number 3. I hope you have a good time with it too. You're going to be surprised that you're looking at a dissected cat you've only seen once before, and you do know the decimal. Okay. Okay. If there are no questions, well, we can get them later. I'll share, and it seems to take me, for some reason, when I try to share the screen, it stalls for about 15 seconds, and then it picks up, so hang in there. Didn't stall this time. Okay, as we talked about on Tuesday, I've indented things that are important to you. Those things that I did not indent do not have any information for you for P3. So I want to back up here, see that I didn't skip anything. Week 5, nah, we just did that. That's good. That's good. Okay, the list of heart structures, it's, we don't need to open it, waste our time on it today. It just has the names of the structures. You need the name of the structure pointing to the structure, and we need to see the pictures for that. Okay. We're going to just go in order. I'll try not to take as much time on things that we already know. Okay. The date is wrong here, obviously. Here's the parts of the year that you need to know. Okay. We're going to see them in a picture in a moment. That's where it counts. Now the ear is only worth 4 points a station. So 2 stations, 8 points. Here it is. The pinna, the outside of the ear, the part you can grab a hold of if you wanted to. Okay. The auditory canal, that can be called the acoustic canal as well. It stops at the eardrum. We won't call it eardrum. We call it the tympanum or tympanic membrane. If you were able to bust through to the other side, there's a tube that goes into the pharynx. This tube is the eustachian tube, and its purpose is to equalize pressure on both sides of the tympanum. If you didn't get this pressure equalization, then your sound perception is going to be distorted. Here are our ear ossicles. Here's the malleus here, the incus here, and the stapes, sometimes called stapes. Okay, you must use those terms. You can't use the colloquial terms, hammer, anvil, and stirrup. Okay, the stapes joins with the vestibule. The ossicles transmit sound. Then the vestibule contains a fluid, semicircular fluid, that goes into these semicircular canals. As you bend your head, it'll flow in, the fluid will, or out, and give the brain an idea of the orientation that you have. The sound perception is done by perceptors in the cochlea, the snail or cinnamon bun is the cochlea. You have nerves coming out of the cochlea and out of the vestibule that join together and are called at the same time the eighth cranial nerve, the vestibulocochlear nerve. Okay. You're going to be asked 3 cranial nerves only on this test. You're not going to get the cranial nerves in mass until we get to the 3rd lecture test. The 3 that you're going to get asked here are this one, number 8, the vestibulocochlear. You're going to be asked number 1, the olfactory, and 2, the optic nerve. Okay, that's it for the ear. Any problem with the ear? When I say any problem, I mean any problem you can't solve yourself or want some help with right now. Okay, great. Here are the parts of the brain that you need to know, 15 parts. If I could get them all in, it would be nice. Okay, well, we'll see them in just a moment. Here they are. 2 sheep brains. Okay, and we'll start with the back one. This is the underside. This is the pituitary gland. It's the main endocrine gland of the body. Secretes up to 8 hormones. We won't learn the functions of those 8 hormones or their names until we're ready to do L3. And then we will learn them all. Okay. So here's the pituitary gland. It's been taken off here. This is where it would be here. Okay. At the very back of the brain is the spinal cord. It will swell to become the medulla oblongata, sometimes just called the medulla. Imagine this turned over, upside down, or right side up, actually. Just turn it over. This structure, the cerebellum, sits on top of the medulla oblongata. Forward of the medulla are 2 rounded structures, bilateral, and these are the pons. The area of higher thought is the cerebrum, Here's cranial nerve number 1, the olfactory lobe. Here's the olfactory lobe on the other side. This brain's been sectioned in half. Here's the cerebrum out here and down here. There is a ventricle, a chamber, just like the heart has ventricles. These chambers are the lateral ventricles, contain cerebral spinal fluid to cushion the brain and to also provide some material for nourishment. A rounded area in the center, which I always say looks like a little scallop, is the thalamus. And under it, the hypothalamus, the seat of the autonomic nervous system. This is the this is the corpus callosum. And it will show better in the bottom picture. Towards the posterior of it, we drop off, and there's a little gland, the pineal gland or the pineal body, which produces melatonin for sleep. It's an endocrine gland as well. Behind that, in between it and the cerebellum, is the corpora quadrigemina. The corpora quadrigemina is named because we can see it, but its function is not that much, not that overwhelming. It's passageways from one part of the brain to the other. In the cerebellum, this little slit down at the bottom is a ventricle, the fourth ventricle. The fourth ventricle unites by passageways with the lateral ventricles and with the spinal cord, and we cannot see those passageways. The arborvitae is the tree-like structure that we see inside of the cerebellum. Here it is down here. Now we use a lower diagram, which is probably clearer. Let's start with the rounded structure. This is the thalamus. Hypothalamus, not labeled, would be below, right here. The hypothalamus does not have a clear structure. It doesn't have to. You know, just because you want to point out Kansas in the United States. Well, yeah, most maps have it clearly defined with borders, but get rid of all those borders and such, and how do you know where it starts? How do you know where it ends? This is the hypothalamus, and no borders around it. Here's the corpus callosum. The corpus callosum takes information from one side of the brain and shares it with the other side of the brain. Here's the pineal body, corpora quadrigemina, cerebrum, fourth ventricle. The arborvitae isn't pointed out here, but it's very obvious. And here's our pons. We don't see it as two rounded structures when it's cut in this direction, but there they are. The medulla oblongata is sat upon by the cerebellum, sorry. Okay. And then trailing out the posterior is the spinal cord. Here are the functions of the brain. How many are you going to get asked? Probably about 4, maybe 5. Okay. You may have to enlarge that a little bit for yourself or print it out. Then we're going to look at the eye. We're going to look at these materials. I'm looking through them myself just to be sure. I did something I probably should have been more careful with. When I show you the posterior chamber, the large area in the back of the eye, there's a portion of it that is called a chamber and a portion of it that really is technically a cavity. And I've used both terms in the same line. Okay. I'm not going to try to fool you on this test. If I want that posterior area, it will say posterior chamber, or it might say posterior cavity. But there will be no other posterior anything as a possible answer. Okay. So when we see it in a moment, you'll understand. Okay. All of this area here is the posterior chamber or posterior cavity. I'm going to use them interchangeably. Okay. They're filled with vitreous humor. The vitreous humor is a gelatinous substance, and its presence and pressure keep the eyeball in shape. Here's the retina pressed against the edge of the chamber. It obviously perceives light. That light, those transmissions by bipolar neurons, exit here, the yellow spot. This yellow spot is the optic disc, and it cannot perceive light. So you have a blind spot in your eye, each eye. But since they're both going to be at different spots, and they'll be a little bit more medial than center, they compensate for each other. What the left eye misses, a little spot of vision, the right eye will pick it up and vice versa. So this is the optic nerve leaving. They're not showing much of it. Here's the optic disc. Here's the retina. When light comes in, strikes the retina, it will send information towards the optic disc, optic nerve, and the brain. But some of the light, much of it actually, will pass through the retina, which is thin, very thin, translucent. And if it were to get to the back behind it, it might bounce forward and really blur this up. What do I mean by blur it up? You've been driving and somebody with bright headlights comes at you, and as they get closer, you just can't see. You got to look away, trying to blink them to get their headlights down. Often doesn't do any good because the situation's over with before you get started. Well, we don't want light coming in and bouncing around all through this chamber. We want it to be absorbed, and it's absorbed by this blue layer. This is the choroid coat. Its function is to absorb the light. And then containing everything is this white material, the white of your eye when it's in the front. This is the sclera, a very thick fibrous coat to protect the eye as well as it can. The iris isn't clear in this picture at that level, but the iris is the colored portion of your eye. Function of the iris is to open and close to admit more or less light into the eye itself. The pupil is the opening left by the iris through which the eye light can pass. The pupil is not a structure. It's like a doorway that you can walk through. Then when the light does pass, it will go through the lens, which is fallen backwards in this model.
Charlie, going back to the lens, you didn't have it bolded or there's no definition. Is that part of the test or no?
I had no definition for lens.
No, and it's not bolded.
Here,
Yep. Number 3.
Chris. Oh, okay. I had it, but I had no definition. You know why? Because I guess I thought we were all born knowing the definition. Okay, it focuses light. Okay, so let's remember that the lens focuses the light. Okay, I need you to do that because I can't tell you right now if it's on the test or not. Okay, this isn't the test that I did in the room. This is the test I did do, however, but I don't remember if I asked that. Probably I didn't ask it. You know why? It's just too easy. When the light goes through the lens, though, in a perfectly shaped eyeball, not far-sighted or nearsighted, the light ends up where the arrow tip is. That's the fovea centralis. That's not labeled here. I think it is in a future one. Fovea centralis is where light focuses. Now, this model shows the fovea centralis as a structure, but it is not. It's the point where light would focus in a perfectly aligned eyeball. That's straight back. Here's the fovea centralis here, barely see it. Optic nerve, optic disc, choroid coat. Here's the crystalline lens. Here's the retina unlabeled. But what we're showing this one for is the ora serrata, the red line stops here. The ora serrata is this material here. And the ciliary body is here. Okay, the ciliary body will do first. When we take this lens, stand it up and place it in here, okay, then the ciliary body attaches to it all the way around. And the ciliary body contracts because it is smooth muscle. And the ciliary body causes the lens to change shape and therefore allow differences in focusing length. But you can see something near, turn your head, look at something close, and then turn back again. Okay, the ciliary body is responsible for helping the lens change. Now that can't happen all your life. Once you hit about 40 years, the crystalline lens gets kind of hard, and the ciliary body is not very functional. Can't budge it. That's when people, as I said before, run for reading glasses first, or they might, if they got money, they'll go for LASIK. But the ciliary body in a person who's 40 or less is to change the shape of the lens. The ora serrata is there to complement the choroid coat in its function of absorbing light. Some light comes in from the side. Follow the arrow, comes in sideways. It's not going to hit the retina. The retina doesn't extend down to here. So it hits here instead, but instead of being able to bounce around, the ora serrata absorbs it. Only place where light is perceived is in the orange area. I think I can get that color right. Okay, about 3 or 4 places in our material, I have listed the parts of the heart you need to know, and here they are again. Okay, of all the single things that are on the test, the heart has the greatest number of questions. So let's go through it. Okay, I'm going to go through it not well back and forth. Sometimes I'll use the labels, but usually I'm going to use the structure. Here's the front of the heart. This is the apex. It has no label, but in a future picture it will. I don't mind saying it now. Here's the apex. Here's the right auricle. Here's the left auricle. Running between the two on the front or anterior side of the heart is the pulmonary trunk going to the lungs. It's taking deoxygenated blood through the pulmonary artery on this side and on this side towards the lungs. Here's the superior vena cava. The inferior vena cava is shown, but not good enough to, I guess, label. It's down here. It's coming up, and they both enter into the right atrium. The aorta, seen here. And then you do want to remember the ABCS. Aorta, brachiocephalic artery, or if you want to say trunk, fine. I'm not going to say trunk on the test. I'm going to say brachiocephalic. The next one is the common carotid for the left side. And then the left subclavian. You don't have to worry about left. You don't have to worry about labeling. You have to worry only about picking out the answer from the 5 or so possible answers that are given to you. The portion of the aorta that now extends downward behind the heart and not shown here is the descending thoracic aorta. Okay. The heart opened up. Here's the right auricle. Here, sorry. The atrium is here. Right ventricle is here. Separated from the right atrium by the tricuspid valve. From the right ventricle, blood enters into the pulmonary trunk through the pulmonary semilunar valve. Goes to the lungs, comes back through the pulmonary veins. There are 4 of them. And while some things aren't labeled on this diagram, you see they are in the next diagram. Here's the left atrium. Here's the mitral valve. Here's the left ventricle, the largest chamber of the heart. The exit is not shown here. We have it shown in another diagram. Here's the same heart opened up with different things labeled: the tricuspid valve, the mitral valve, the chordae tendineae are here. Chordae tendineae are here. Here's the pulmonary semilunar and the trabeculae carneae, the roughened walls of the ventricles, only in the ventricles, are shown here. In the she part, the easiest thing to identify is the apex, down here. Then you look at the two ventricles, and you want to pick out the larger one and call it the left ventricle. Immediately in there, I can find chordae tendineae. Not a bunch, but they're in there, these cords. At one end of the cord is the papillary muscle. That's here. At the other end of the cord is the cusp of the valve. And since we're on the left side, this is the cusp of the mitral valve. The tricuspid valve is over here. Barely see a cord. The right ventricle. And in between the two, the IV septum. You needn't worry about the atria in a cross section of the heart like this. They show differently on each heart. They're not difficult, but if it's your first time looking at them, they'll throw you for a loop. So don't worry about the right atria. Just go up to the valve, tricuspid valve, and a ventricle below it, mitral valve, and a ventricle, the left one below that. Okay, I believe my pictures are better than this one, but sometimes a tough picture really helps you to learn. I see that I've got a dissected heart. Okay, I can name some things here, and they're not even labeled yet. Epicardium, which is visceral pericardium. Also myocardium, and myocardium here. And this is probably the myocardium that makes up the IV septum. Okay. This and this were cut in an angle. Here are chordae tendineae. That's unmistakable. At one end of the chordae tendineae must be a valve cusp. Here it is for the mitral valve. Since I'm probably on the left side, how do I know that? Because it extends down to here. The ventricle is just not perfectly straight. Back to the chordae tendineae. The other end of the chordae tendineae attaches to a papillary muscle every time. And there's the papillary muscle. Some trabeculae carneae down here. The aortic semilunar valve actually shows this time it's at the top of the left ventricle. This just simply names the three layers of the heart that I just went over with you. The epicardium or visceral pericardium, the myocardium here and here, and I didn't name this one. It's pointing at a papillary muscle, but everything inside of the chambers, everything that blood would touch, everything that ink would stain and moving through the heart one time is endocardium. Okay, there's where we were under week 8 on 12.2. The list of heart structures is repeated here. There's nothing new there. The heart review. Yeah. Let's get rid of the heart finish before we take our break. Okay, we just had this one. That's great. Sometimes I ask for submissions from students, and they're in the same group. They have the same picture, so they put together the same uh, submission. That's fine. We just saw this. We didn't see this. Here's the IV septum, right ventricle, tricuspid valve. Here they got the atrium over here. Bicuspid valve. This is the left ventricle. However, the needle is actually pointing at a papillary muscle. Okay. My question would be worded so that you would have no confusion between which I wanted. Then the apex. We just saw this picture. That's a really nice picture of chordae tendineae. I'd be tempted to use that. We saw this heart, we didn't see this labeling to show endocardium, myocardium, and the visceral pericardium, also known as the epicardium. Also, the trabeculae carneae shows. On this heart, here's the right atrium, here's the left atrium. On a real heart that you hold in your hand, your real challenge is which is the bottom, which is the top, which is the right, which is the left. Get it turned properly. You need this pulmonary trunk facing you, and it'll go off at about a 45-degree angle here. Okay. But here's the pulmonary trunk. Here's the aorta, superior vena cava. There's a left pulmonary artery here coming off of the pulmonary trunk. It's only slightly visible to me. Not the type of question I would pin for you. However, please, this is the left coronary artery, here's the right. Where are they coming off of? They're coming off the two valves or two cusps of the aortic semilunar valve. The semilunar valves have three cusps. The tricuspid has three. The bicuspid or mitral has only two. When blood comes out of the left ventricle, it's forced into the elastic aorta. The ascending part is quite elastic. When the ventricle quits contracting, the blood tries to flow backwards. It can't because of the semilunar valve. But on the semilunar valve, the aortic semilunar valve, two of the cusps have channels or holes in them that allow blood to leave and go to the heart through the coronary arteries shown here, right and left coronary artery. This is the posterior of the heart. Here's the vena cava coming into the right atrium. Here's the aorta coming over at you. Okay. This would be the subclavian, carotid, and way in the back, the brachiocephalic, just to challenge you. This is the trachea, shown to be realistic. Here's the right atrium, left. Here's some pulmonary veins. There's two here. There's got to be two more. Here they are. One, two. These pulmonary veins here have united and they'll enter into the left atrium. These two have remained separated. We have four pulmonary veins coming back from the lungs. Whether they stay separated or they unite before they get to the left atrium doesn't make any difference. The coronary sinus, bringing blood back from the heart, from the cardiac circulation. This is the coronary sinus, the whole thing. You would consider this to be deoxygenated blood. Look at this broken heart. Somebody dropped this. It's my favorite. But here's the. I told you I was going to correct this one. I'm remembering that right now. I haven't corrected this. Start up here. Here's the auricle. That's true. Here's the apex. Well, of course. But that's not the right atrium. Okay. Now, it could be several things. It could be the epicardium I'm pointing to. Okay. But if anything, I want the chamber. It's the right ventricle under that. Okay. Here's the coronary sinus, feeding in first to the inferior vena cava and entering into the right atrium. This is not the right atrium. This is the left atrium. The right atrium's not visible, actually. It's on the other side. These are pulmonary veins. 1, 2, 3, 4. Please don't ask me what that little one is. I have no idea. Okay, ocular orientation. Here's the apex down here. This is going to be the pulmonary trunk. When you pull it back, here's the pulmonary semilunar valve. We get to see a bit of the tricuspid valve on this side with the chordae tendineae. And this little bit here would be a portion of the IV septum. This shows it a little bit better. Same thing, pulled back from the pulmonary trunk, pulmonary semilunar valve. That takes the blood to the lungs and brings it back to this chamber. This is the left atrium. There will be 4 pulmonary veins coming back. 1, 2. And when you put on the lid here on this side, the missing piece, it does have the other 2. There's 4 pulmonary veins coming back to the left atrium. Here's the mitral valve. Here are the chordae tendineae. Really good trabeculae cardiae. And going out, here's the aortic semilunar valve, shown very nicely. Also shown nicely is the myocardium. Nothing new, I don't think on this one at all. Pulmonary semilunar, mitral, aortic semilunar, you can't see it in this picture. It's pointing to where it is. Chordae tendineae is there. Trabeculae carneae here, that would have been a good spot for it. And the tricuspid valve. Pulmonary semilunar valve with 3 cusps. 1 cusp, 2 cusps, the other cusp in white is down at the bottom end of the structure here. It's right there. Okay, nothing new here. Just a chance to review it again. All these labels we've done. On the posterior side of the heart, here was the trachea and the esophagus, with nothing to do with the circulatory system, of course, but they're shown to be more realistic. So when you do see them, you don't get confused. The inferior vena cava is down here. The superior vena cava is up here. That's that. Okay, it's 3:12. Take a break till 3:25, and I'm going to be doing the vesicles with you, I think, for the rest of the afternoon. Okay, 3:25. Okay, we're back. Well, we got a couple more to turn their cameras on, but just a question for you. I was watching on the news last night where they're talking about the numbers of students that are applying for nursing school. It's gone up quite a bit. You know, you would possibly think, well, no, the people don't want to get into that field considering the situation that we have with the pandemic, of course, and how burned out so many health workers have gotten themselves. But do you think, if you're interested in nursing, and I know not all of you are, but for those who are, you think you'll actually have a better chance of getting in, or a harder chance of getting in because of the numbers of people?
I feel like it's been really competitive right now, so it worries me a lot.
Why would you be worried about the competition? I mean, how are they going to be better than you? Aren't you going to get an A?
Well, I have an A in this class, but I got a B in micro, and I probably needed an A. So that worries me a little bit, but micro was really hard. And physiology, that's going to be really hard for me as well. So
Well, physiology is going to be hard for everybody. I don't care who they
yeah,
are. You know, so
yeah.
it's really keeping up with it, keeping a clear head with it. And if you get an instructor who is helpful, asking the right questions when you need it, don't wait till you're buried in it. Anybody else?
I think there will be some turnover, like at some point. I think some people will end up leaving the hospitals. I've read studies about even there being a cycle of people aging out. I think some people will just be burnout.
I think so too.
I think it's cyclical.
Yeah.
So don't give up.
No, don't give up. Definitely. I try to keep in touch with some of the students who have asked me for recommendations, and then I get emails back with photographs of them standing in front of their hospital in New York or wherever it is that they ended up at. Got one guy. Usually you don't have doctors coming through this class, but I've had about 5, that have gone on to become MDs as well. but lots and lots of, I think really right now, of course, there are a lot of openings. And I don't know how many of the people that are applying, you don't either, are going to see it through, you know. So anyway, at the end of the semester, if you did well and need a recommendation, I'll give it to you. What if you didn't do well? I had one guy, not in health science. I had one guy ask me for a recommendation, and I said, "This is the last day to put a recommendation in. Now I got to sit down and write. I don't enjoy doing recommendations. I got to tell you that, but I'm very truthful, and I'll give you a good one if you deserve a good one. You know, really good." And I just put my mind into it. But this guy came up to me on the very last day. I had other things to do, you know. We usually do recommendations on Fridays. And I said, he was in another one of my classes. I said, you're going to get a D or an F in the class. He says, I don't care. I just need the recommendation. I have to have 3 recommendations. I said, oh, I'll write you a recommendation, but it's going to be saying exactly the conversation we just had, that you don't care that it's a bad recommendation. I think he was banking on that they won't read the recommendation, they discount them. I don't think that's going to be the case. Never heard of him again. Okay, any questions that you had since you had your nap? I'm always afraid to take a break because I've always stayed up late, and if I'm a little bit tired, I'll sit down and I could fall asleep. So I got to keep running around to keep myself awake and enjoy this. Okay, then let's put this back. You're seeing this where we left off on this heart, are you?
Yes.
Thank you, thank you. Okay, well, we don't want it. We're done with it. And let's put the screen back. Before I go on, I want to go to my website. Okay, here it is under week 1. That's way at the top of the page. Try to remember to move it down into your area so that you'll remember it. Okay, there's not a lot that you need to see there, but okay. One thing, your scores, you know, I sent them to you, but you can always come here. Give me a day after the test, though, and you can get your scores right there. Okay. I wanted to come over to this side. Under Unit 3, the vessels, that's the list that I sent to you. And I also put this list on our Canvas because one of the students, Laura, had asked me for this list, and I really should have made it available earlier. But these are the vessels that you may be asked to name. Not with left or right, not with artery or vein. You can come down and review the white blood cell types, what they look like. Know what each does. Here's our neutrophil, our monocyte, which is large or small lymphocyte, and the 2-lobe eosinophil. Okay. The artery and vein photo. I don't think I've shown it to you yet because it's in the histology section also. But the artery and vein photo are cross sections of arteries and veins. And you will be asked this on the test on Monday, a Tuesday. Okay. Now, I don't mind actually showing you something at the last minute because that usually gets people's attention better than anything else except for fear. Fear is the best teacher. Okay. Here's an artery. Now it's an oblique section through an artery. The blood's and lumen are in the center here, surrounded by adipose. But look how thick the tunica media is. Whereas in the vein, it has a more relaxed shape. And the tunica media is extremely small. It's the artery, muscular artery, that pulsates. And when it's near a vein, it causes the vein to change shape and push the blood and lumen of the vein to the next compartment. Compartment because the compartments of the veins are separated by valves. All you have to do here is say that's an artery or an arteriole, we don't know, or this is a vein or a venule. I also have some review PowerPoints. And I know if we go through all these PowerPoints, we'll end up duplicating some of the material that we just did. Let me try one just for the heck of it. I'm going to try the third PowerPoint. I think that's probably one of the better ones. Okay. Now, this is not posted directly on the Canvas page. Okay. Canvas has its own pictures and they're quite adequate. But a lot of people like the extra review. So let me do PowerPoint 3. There it comes. I'm definitely skipping through this one if there are things that are not important to us. Okay. This is a cat that we saw earlier. So it's probably sort of a repeat, but it's beautiful. Superior vena cava here. Splits in a Y fashion. Those two arms are the brachiocephalic. This is an unlabeled vertebral coming up from the bottom. Here's the external jugular, unlabeled here. It'll be labeled next diagram. Here's the brachial way out here. You can just jump to this one. Come back. This is the subscapular, and this is the subclavian. Well, let's see what the next one says. It's labeled subscapular. This is the vertebral. The transverse scapular, got to follow the arrow closely, is over here. Maxillary. You're calling this facial, but I prefer lingual facial. And here's the transverse jugular. You know, the one that they didn't mention or put a label on is an important one here, the external jugular. Come back down on the external jugular till you get to this crotch. As you head out to the arm, the first part is the subclavian. Coming off of it is the subscapular. Continuing from the subscapular is the brachial. Okay, superior vena cava, brachiocephalic, subclavian, transverse scapular. See, it was over here a little. more on the last cat, but this looks good. Here's the external jugular. Here's the internal jugular. And then the brachial out here. So far, these three have been very good PowerPoints or pictures. And I don't mind showing them to you at this point because I noticed every single person is here. Okay, so we're not leaving anybody behind. A blurry picture, what can we make out of it? This is the heart down here, or where it would be. Superior vena cava. The mammary, the guy took up the arrow and put it right on top of the mammary so we don't see it well. Where it breaks, right here is the brachiocephalic. Common carotid, not as good a picture. Sorry. Okay, transverse jugular, linguofacial, maxillary. And this would be the external jugular. Same picture, different cat, external jugular, linguofacial, transverse jugular or transverse facial, same thing, and the maxillary. Same thing once again. Sometimes we get a load of cats that don't have these vessels very well. And so what happened here, we got a hell of a lot of really good cats, and everybody went to town taking the picture. These are all on different cats, but they're all pretty good. This looks like it's going to be nice. Okay, let's see how nice. We know that the superior vena cava has got to be down here. We're not seeing it, so we're not labeling it. But it splits here and here. This is the brachiocephalic. Brachiocephalic continues to here, and now it's split again. The first part is the subclavian. Okay. And although this is probably the subscapular, it's not clear enough to label, so we don't label it. Instead, we go up here. Now, this may look confusing until you understand it. The outer one is the external jugular. Here's the transverse unlabeled. And the inner one is the internal jugular vein. It usually does not inflate this well. And in fact, it's sort of an exaggeration of its size. But that's the internal jugular. Creeping underneath here and here are the common carotids. Okay. And down here, that's a different story. Here's the subscapular artery and vein running together. Once we pass the subscapular, it is brachial all the way. Brachiocephalic at the V, here underneath the heart, coming off of the superior vena cava is this one that dives down. This is the azygos. Here's the inferior vena cava.
Hi, Charlie.
Yes.
I'm on your website and I'm clicking through all your PowerPoint slides because a lot of these photos are not part of the handout and I can't access them. I don't know if I'm the only one, but this stuff looks like I really need it. It would be very helpful.
You're logged in at the same time though, right? Do you have PowerPoint?
Oh, you know what? I might have logged in before. Let me get out of here and try it again then.
Okay, so leave us for a while, okay? And then come back and let me know.
Will do. Thank you.
Anybody else? Well, I don't anticipate you're going to have difficulties, anybody, because I've had these here for 10 years and I haven't had people have problems. So
I exited it out and I still can't access it.
okay, and then you came back in.
You mean the Zoom or your website itself?
I'm on my website,
Right.
and you're accessing it from Canvas, so you probably can't also access it.
You know what? I have it bookmarked, so I'm going off the bookmark. Let me go through Canvas. Okay, I'll log out of Canvas and then try go back in.
Yeah. Leave us. Just leave us completely out. Get out of here. Okay.
Will
Go
do.
and try it, then come back. Okay. Let's hope she makes it. Okay. This one looks sort of a mess at the moment. But no, here's the heart, obviously. So this must be the superior vena cava going up to here. This is the brachiocephalic. This is the brachiocephalic. Coming off of the aorta, here is the common carotid and common carotid. The aortic arch is way down here, and it's really, I wouldn't label that. It doesn't show well enough. We'll find it. Okay.
All right, I exited out of everything. I'm on Zoom through my iPad, so it's not even connected, but I still can't have access. Am I the only one having this problem?
No, I can't access it either.
Thank you.
I was able to get into the PowerPoints and download them.
You got them. Okay. Do you have PowerPoint or PowerPoint Viewer? You don't need PowerPoint, but there's a free app called PowerPoint Viewer. You
I
know,
do have PowerPoint.
well, then I can't understand why. Okay, I'll tell you what.
Check to see if your blocker's on your download blocker, because my download blocker just popped up saying that it wouldn't download the PowerPoint, and so I had to disable it from Saddleback. You can do that by going up to the top left-hand corner or top right-hand corner of the search bar, and it'll say like an X or the little thing will pop up, I guess.
And there's one more thing you can do. View it when I post the recording. Pause the recording on every picture. You'll see the whole thing. Not where you want it, maybe. Are you still there?
Yeah, I'm still here. I hear what you're. I'll figure it out. I can always go back to the recordings.
Exactly.
Thank
Okay.
you.
Because we don't have time to. Well, you know, I love figuring these things out, but I can't do it right now. But everybody can come to the recording and stop, pause whenever they have a picture they like. Okay. So let's go through all of them. I'll go through all of these PowerPoints. I think that'll cover everything anyway. And by doing so, everybody will definitely have access to these, even if they don't have access to PowerPoint, which you should. It's a basic program. You know that. Okay. What do we got here? Here's the external jugular right here. This is the common carotid here, and on this side, common carotid. The internal jugular has been marked here. Look how small and scrawny that one is. If I give you an internal jugular, it will be obvious what it is. You know, I don't like this one. I don't like this one. They're not incorrect. They're just not good examples. So maybe it is a good idea. Come back to the recording and hear what I say on a couple of these like that. And then after I've said my piece, pause it and study the rest of the recording briefly and then go on. Okay, so I'm gonna push it. Immediately, I don't like this picture, but it must have something. Yes, it does. It has the brachial way out here. That's fine. That's got to be correct. And the axillary artery right here. Axillary artery is just before the subscapular artery. Down here, unlabeled, and subscapular vein. Okay. Here's the axillary. The transverse scapular. Here's the external jugular. Here's the transverse scapular. It doesn't look brilliant in this photograph, but that's where it runs down the side of the neck. The right common carotid, I can't see it. I mean, I got to move the something out of the way here. So you got to realize that some of these have a few poor labels, but most of them are helpful. Okay, this is the same cat. Okay, so here's the axillary. Subclavian vein is way back here. Follow the external jugular back till you get to the crotch. And this is subclavian this way. And brachiocephalic would be this way. This is superior vena cava. The small vessel coming upwards here is the mammary vein. And this little pigtail, I call it that, of an artery because of its color, is the mammary artery. The mammary artery and vein often come together like this. This labeling of vertebral, if you're listening to watching the tape, is inadequate. I don't see any vertebral there. Okay. And that gives me something to do tonight. I'll open up these PowerPoints and eliminate anything I think is useless. But most of this is very good. External jugular, facial goes up here. It's not well ejected, but the maxillary goes here. And the transverse scapular is right there. Transverse scapular, we know. Facial, we know. Or linguofacial. External mammary, maxillary, we know that. External jugular, we know that. Here are the carotids, one here, one over here, running up either side of the trachea. Transverse scapular is coming down the side here after the subclavian. After. Okay. And the brachial is way down here. The superior vena cava is up here. They didn't label mammary, but that's it right there. Brachiocephalic is from here to here, and from here to here, the Y. After you get past the brachiocephalic, okay, you're going to look for the external jugular. Here it is, and it does twist and turn. Okay, here's the crotch of the external jugular, and this part coming out is the subclavian. The subscapular comes off, and it's coming off here, right here. And everything after the subscapular is brachial. Brachiocephalic again and again. Superior vena cava. Subclavian comes off here. External jugular goes here. Transverse scapular here. And here's a much better shot. Just a slight movement of the camera. This is the subscapular vein. The artery runs right with it. Here it is. And then past the subscapular is the brachial. Okay, common carotid, external jugular. This is the internal jugular, and it's not inflated. So it's correct, but I would only ask you a better looking one than that. Here's the brachiocephalic, superior vena cava. Here's a beautiful mammary vein, the best one we've seen so far. It's twisting backwards, coming off the middle of the superior mesenteric. This is a vertebral vein. That's good. And you might want to magnify it to see that one. Vertebral vein and a vertebral vein. Okay. Orientation once again. Where are we? Well, that's familiar. That's got to be brachiocephalic. That's got to be brachiocephalic. There is a very clear vertebral vein. Hang on. Superior vena cava. The mammary. That label is not there. It's probably going to be on the next one. Left common carotid is running through here. I prefer it when you see them as nice chords. It's down here. There's the right. The axillary artery is not showing you anything distinct. That should come off. And I don't know what happened here. Let's see. Oh, I see. Mammary artery, yes. This is coming off of the left side of the heart. You have two parts, two vessels. Okay, now this was the venous system. This was superior vena cava and going out to all the veins. But from the aorta, we have two distinct things. We have the brachiocephalic artery. This is the brachiocephalic artery. Okay, there's their label. They've got it. Brachiocephalic artery. Okay, part of it will split and go to the common carotids here and here. And the rest of it will go out into the arm. Also, you have the left subclavian. Now remember in the heart, the A, B, C, S. The A for the aorta, E for the brachiocephalic right here. In the cat, the common carotid is not here. It splits up higher to make the two. So in the cat, there's only two vessels coming off of the aorta, and that's the brachiocephalic, and this one, which is the left subclavian. It can be just called subclavian, but the left and right are so distinctly different that often people make an exception and use the left. Here's the left subclavian. The first vessel that comes off of the left subclavian, right here, is the mammary. The mammary. directly across in the mammary. There's a little vessel that fools many people. And, you know, I'm not putting the test together to fool you, but I want to tell you about it. This is the vertebral artery. Okay. When you got vertebral veins, you're bringing blood back from the spinal region. So you got to get blood to the spinal region, and the vertebral artery will do that. Okay, how many times we need to see superior vena cava? We just have to put up with it. Brachiocephalix, subclavian vein, external jugular. This is the subscapular. This is the subclavian vein on the other side. This structure here, unlabeled, is the external jugular. And this is an internal jugular here. Now, they're unlabeled, probably because the person couldn't figure them out. And I'm not going to ask you to figure that out either. Okay. External jugular, we know that one. Let me cut down the size. Here's the azygous vein. Really eerie looking snake-like vein that comes off of the superior vena cava. You have to pull the heart away so that you can see under it to see the azygous vein. Okay, now we're in the abdomen on this one. This is part of the diaphragm here, getting our orientation. How else can we get orientation? Got to realize maybe that's the kidney, and that's the kidney. Oh, that must be the renal vein then, or just call it renal. Okay. Oh, and here's the one coming off the left renal. This is the gonadal. Okay, so we're starting to get some orientation, get the ones out of the way we need to. This must be the vena cava, not labeled here. And this is the suprarenal, because this is the adrenal gland right here. Here's the aorta punching down, coming in. And then first thing off of it right here is the celiac trunk. This is the celiac trunk. It'll divide three ways. Go to the stomach here. This is the stomach then. This is the gastric. Okay. And this towards the spleen. This is a part of the spleen. And this is the splenic artery. The hepatic artery never preserves. I've never seen it. I gotta say. I'll celebrate if I ever do. Now, how's the spleen getting itself over to the right side? Because somebody took their hand and pushed all the organs over to the right side so we can see this. Come down the aorta and the inferior vena cava to here, and going across are the iliolumbar artery and vein. This is the longest PowerPoint, by the way, so don't get too excited. Okay, now we got a kidney, that's for sure. This looks like liver. Okay, so the head end has got to be up here, caudal end. Okay, renal vein. Here's a gonadal on the left side. Okay. Here's the abdominal aorta. Here's the inferior vena cava. The celiac trunk is in part right here. It's been broken, so I'd never asked that. But the next vessel coming off of the aorta, okay, is the superior mesenteric that goes to the small intestine. Superior mesenteric. In the iliolumbars here, going straight down the middle. See that one? Mid-sacral or middle sacral is fine. Going to the tail. The external iliac artery is here. The internal iliac artery is here, but it's obscured in part. So we'll look for it on another one in just a second. Okay. Renal, gonadal, inferior vena cava, abdominal aorta, renal vein on the other side. Here's the superior mesenteric. Here's the broken celiac trunk. Should attach right there. Okay. Iliolumbar, iliolumbar. Down here, external iliac artery, internal iliac artery, mid-sacral or middle sacral artery and vein. On the other side, we have the external iliac vein. We do have a common iliac vein back here, but it's not able to be shown on this one. Okay. This is the same cat. You can see by the cuts that are made. So I am looking for anything that's different. The only thing additional is the femoral. This is the femoral out here. This is the femoral artery right next to it. This is the deep femoral, unlabeled. Deep femoral coming across. Never goes all the way. The common iliac vein is really right at the tip of my pointer. But I do believe you're going to see a picture of it in a second. Common iliac vein. And here's the external iliac vein. What's the difference between the two? A vessel comes off right here. It doesn't show. It needs to show for me to ask that question. The vessel that comes off is the internal iliac vein. Just hang tight for a moment. Okay. This is the inferior mesenteric artery. Here's the aorta, iliolumbar. Here's a gonadal artery. Really lucky to get that. It's coming off of the aorta, so it's actually probably a male cat, gonadal artery. External iliac artery, internal iliac artery, again. That's the way you learn it, again. Femoral artery and vein. Same. Deep femoral, yes, it's right there. Iliolumbar, inferior mesenteric again. Okay. This is the suprarenal vein, and this is the renal vein. People didn't do a very good job of dissecting here, so unfortunately we can't see a heck of a lot of stuff. We can see the inferior vena cava, that's for sure. Okay. This is a gonadal vein. It's not coming off of the renal. Okay. They don't have to. The gonadal vein on the left side can come off of the renal, or it can come off of the vena cava. But it's still going to go to the sex organ, in this case, the ovary. To be safe, we always just call it gonadal. Iliolumbar goes across here. I don't know if I would have taken the time to photograph that cat. This one's a blur, but it's got some stuff we can use. Here's the mid-sacral and the artery right with it, even though it's blurred. Here's the aorta up here, external iliacs here and here, the internal iliacs here and here. This is common iliac vein right here, and also on the other side. Now it splits. It continues on as the external iliac vein, or drops down into the bowl, the pelvis, as the internal iliac vein. We need a separation between the common iliac and the external iliac, and that's going to be this one, the internal iliac. Femoral artery, won't give any trouble. Okay, different cat. Here's the great saphenous vein. Here's the popliteal vein. Remember that one going to the knee? Here's the left common iliac vein. Okay, we've got it. This is the left common iliac vein. It's coming along, and there's a vessel coming off it right down here. They didn't name it, but it's the internal iliac vein, followed by the external iliac vein. And then when that punches through the abdominal wall, it will split right here and give you the femoral. What else? We did the internal, I'm not going to do that again. Not necessary. Okay, we got through one of them. I know that some of these are shorter. Now I'm going to just do them in order. If you are hopefully benefiting from this, great. If not, you can exit when you've had enough or can't take any more or whatever. Okay, This is the model, and the model here is labeled. I think our model is labeled too, but we don't have as many models. Okay. Yes, I did this one with you the other day, this exact model. I'm going to point out that you need to know the axillary vessel. I'm not going to call it artery or vein anymore if I can help it. This is the axillary, right there at the armpit, or where the scapula and the humerus meet. Okay, vena cava, brachiocephalic. This is also the brachiocephalic artery here. In the human, we have a common carotid on the left side. Okay. And then we have a left subclavian going over until we reach the axillary. And further down, we would always call it the brachial. Okay. I mentioned to you that I'm not going to ask you the hepatic artery and vein. It's easy to put it on a model, but it's damn hard to find it in a cat. Okay. The renal arteries, the common iliac. There is a common iliac artery in the human. The human has both the common iliac artery and vein. This is the common iliac. This is the internal iliac. This is the external iliac. Sorry about that. This shows the midsacral. Common iliac, internal iliac, external iliac. Okay. Femoral comes down, and a part of it splits off, which is the popliteal. The popliteal, look at it, runs behind the knee. The leg is turned out. But on the other side, the saphenous artery runs medial to the knee. So your saphenous artery is on the inside medial portion of your leg at the knee. And the popliteal is if you feel the back of your knee. And here's the great saphenous vein. I didn't give you this. We're not going to do this. Okay. We are going to do this one. Okay, this is the skull, and coming into it, bringing oxygenated blood is the common carotid artery. It splits into the external carotid artery and the internal carotid artery. And a vessel that comes down through the vertebral foramina here. Oh, it's here. This is the vertebral. This is the vertebral. This next one I will not give you. Okay, I'm showing it to you, but I'm not adding anything to that list that I sent you and I posted on Canvas. So you don't have to worry about that one. On this model, the aortic arch is barely visible and cut here. Superior vena cava, brachiocephalic. Nothing that you don't already know. The inferior mesenteric here is only shown as like a internal belly button right there. I'm not going to ask that. I hope I don't have to. I just won't. I will ask the inferior mesenteric on a cat. We just saw some good ones. Okay. This is, however, a gonadal artery coming off here. There'll be one on the other side. It does show. You can see they're going to the gonads. In this case, they're going to the testes. The celiac trunk is also shown here as a nub, and the rest cut off. I think it's almost a crime that they bother putting that in there. I would never ask them that way. We do in class. In class, it's a little bit easier. Okay. All of the rest of this matches the first diagram. Hardly worth doing a blurry picture, when especially we already did all those structures. Renal artery and vein, gonadal artery, again here and here. Same model. Inferior vena cava. Here's gonadal artery, gonadal vein, gonadal artery, and this time the vein is up here. That's fair. That's fair. They've got the superior mesenteric down here and the celiac trunk. They're in the right spot, but I like to see more of it. Here's the inferior mesenteric, and I like to see more. And I wonder why they didn't do the iliolumbar. They're so pretty. Abdominal aorta. This is the iliolumbar, also known as the lumbar. That's not a good picture. I showed you many pictures, and I'm going to pick good pictures. Okay. Common iliac, internal iliac, external iliac, in this case, all arteries. The aortic arch here. Now this one, I may ask, this is the descending thoracic aorta. It'll become the abdominal aorta when it gets to the other side. Here it is as abdominal aorta. Suprarenal. Superior mesenteric again, along with the celiac or just nubs. I won't be asking nubs. Again, common, internal, and external. In the human, there is a common iliac artery and a common iliac vein. In the cat, there is no common iliac artery. Going to the second of the PowerPoints. Okay, we've seen this one. That's fine. Ooh, a lot of labels. Anything new? Nothing new. That's fine. Let's just move on. We've seen this one, and there's nothing new. We've seen this one, and I know we've seen this next one. Okay. If there's anything new that you see that I don't, shout out. I don't see anything worth our time here. No, that was the posterior side. Saw that. We saw that. Saw that. Saw that. We're not doing the eye. You know that. Oh yeah, we're doing the eye. I say. Okay. We're not doing the muscles of the eye. The white is the sclera, and we didn't see it on the other model because it wasn't present. But here's the cornea. Definitely need to know the cornea. Okay. The cornea is this clear area right here in the front. The sclera, the white layer. The pupil, the opening. The iris, its function isn't to have a color. Its function is to open and close or increase or decrease the pupil size. The choroid layer, if you strip off the outer sclera here, here's the choroid coat. And we went over its function. Okay, here's the lens in place. In front of the lens, but behind the cornea, there is a watery fluid called aqueous humor, and it occupies the anterior cavity. Now, if you say anterior chamber, or if I do, we're going to take it, okay? We're not ophthalmologists. If we were, we could be a little more precise, but I keep reading the definitions and they are unfortunately confusing. So the area between the lens and the cornea will be anterior cavity, anterior chamber, whichever you see is correct. Okay. Then behind, this is the posterior cavity. And if you say posterior chamber, I don't care if this says not, we will still go with it. Lens, sort of white chalky circle around the lens in the back is the ciliary body. Then the ora serrata. The innermost layer is the retina. Here's the optic disc, optic nerve. And this spot again is the fovea centralis, which should be straight back from the lens, where light focuses. Here's the ora serrata on the outside again, and the chalk area is the ciliary body. The cornea doesn't look as pretty in real life here. This is the cornea, and this is the sclera in the back. When the eye is cut open, the retina is not just paper thin, it's thinner than that. Here it is. Can easily be peeled back, as this part has been, to show the choroid coat. The choroid coat can be black, blue, or silver, or all of those colors, rather iridescent. Here's the lens. cornea on this, I wouldn't ask because we had a great slide just a moment ago with cornea. Here's the choroid coat on this side. Sclera out here. The ear, we already went over it today, and it's nice on a model. It's pretty. Okay, but there's nothing different. I didn't mention tympanum. I don't know how I could forget that. But there's the model. On the white blood cells, okay, this is sort of an introductory page here. But you want to know the neutrophils? Neutrophils are the ones that have 3 or more nuclear lobes. The lymphocyte has 1 lobe and is about the same size as a red blood cell, maybe a bit larger. The monocyte is much larger. This is an artery. You know it's an artery because of the thickness of the tunica media. This is a vein because of its contorted shape and the thinness of the tunica media. Okay, this is a repeat of the first slide. Yes, I think these are all repeats right here. We didn't have this slide in there for some reason. It's an easy one. Femoral vessels. Here's some more cat. This is a good brachiocephalic artery coming off of the heart. Here's brachiocephalic. And this one over here is the left subclavian. This is that little vertebral I told you about. And I don't know if you can see it. It didn't get labeled because it probably wasn't visible to the person who did this. But here's a vessel coming off here. This is the mammary artery. Let's see if there's a better one. Oh my God. Well, it's sort of a thrashed dissection, and there's nothing new labeled on it, fortunately. This is not a thrashed dissection at all. This is a beautiful dissection. Okay, here's the superior vena cava with the mammary coming off of it. Oh, this is a great shot. Here, the superior vena cava stops in brachiocephalic and brachiocephalic. This is a vertebral. Okay. This is a vertebral. Now we go up, and here's the external jugular, and here's the internal jugular. Absolutely gorgeous. Might as well hit the common carotids as we're going by. Trace them back to the brachiocephalic artery. Coming off the along with the brachiocephalic artery off of the aorta, here is the left subclavian. And here's the first vessel off the left subclavian. It's the mammary. This is a beautiful memory. This little guy here, that's the vertebral. Didn't get labeled here. Person didn't know what it was, but that's okay. This is still the subclavian. And now we get here and we have the subscapular vein and the subscapular artery here. And once you pass the subscapulars, these are brachial artery and vein. Oh, I hope I used this guy on the test. If I didn't, I'm going to dismantle the test just to use this guy. It's really in good shape. Renal, suprarenal. Here's the celiac trunk. It's been cut, but at least we see its attachment to the aorta. Okay. This is the superior mesenteric coming off of it. So you can see the V shape I talked about. And the abdominal aorta continues along. The word lumbar, don't be confused, that's iliolumbar also. No. We saw this one. Nice one, very nice. But we've looked at it. I think we've looked at a lot of these cats, yes. They made their way into several albums. We saw that one a moment ago. No, the rest are the rest on that one were repeats, which are fine. We had enough of those. Was that number 4, or do I have 4 to do? That's our good-looking one, but this one does point out vertebral veins here. That's a vertebral vein there, and there. It's coming from the back. It usually enters underneath the brachiocephalic, or the other brachiocephalic, or both, or the superior vena cava. This one has an internal jugular as well. Okay, it has nice subscapular here, subscapular there, and brachials heading out. Nice color here anyway. We saw this one just a moment ago. No, nothing different. Nothing. That is the bladder in case you lose your orientation. Anything coming over this way, okay, like right here, coming over, we would call deep femoral. And that which continues on outside of the abdominal cavity would be femoral. Great saphenous, upridial, femoral until they divide. And the deep femoral going that way, not a very good shot of deep femoral. Okay, I believe that every question on the test has been covered today. You know, just it's got to sink in now, and I think if that happens, you'll be doing really well. Any questions? Did anybody try the PowerPoint again? Are they still here?
Yeah, somebody recommended that I switch browsers. I was using Chrome, so I switched to Safari and it worked.
And school tells you to use Chrome all the time. When you say you switch to Safari, you're using a cell phone?
No, I'm on MacBook.
Okay, okay. Yeah, you don't want to be using a cell phone for the exam, that's for sure. But the exam has worked for you in the past, so I'd stick with whatever you were doing then and not find any surprises on Tuesday. Good, okay. Anybody else? Well, remember, the recording is going to be posted and you can go through it as fast as you want and stop it whenever you want and study from there. Yeah, somebody was going to ask a question. Thought I heard somebody. Okay, then. Stay safe. Bye-bye.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, Charlie.
Bye-bye.
Bye.